to doing any health, fitness, or performance testing, we need to make sure that before our patient comes into our facility that we have everything properly set up. So one of the first things that we need to do is to gather all paperwork that's needed for the test and have it out and prepared. So things like health history questionnaires, informed consent, because remember we always have to get informed consent prior to doing any testing. We also need to lay out any equipment that's needed. We need to calibrate our equipment for a stress test or a VO2 Max test. Remember that the metabolic cart needs to be on 30 minutes as a minimum prior to starting a test, and then it needs to be calibrated to ensure that all of our equipment is working properly. For a VO2 Max, some of the standard things that you need to have out and ready to go is, for one, you need a clean surface. So you should have one area designated that nothing, no dirty equipment is ever allowed to touch. We also don't touch this equipment with our bare hands. We also need to have an area where we can place our dirty items, so things that have already been used, that can be then disinfected and be kept separate from any clean items. So as we see here, this is laid out as our clean area. As I approach it, I don't touch anything that's on here. Everything that's currently here has been cleaned and sterilized. So my first thing is I need to grab my gloves. Once I have my gloves on, I'm going to start to make sure that everything is put together in order. I need to make sure that I have a heart rate monitor, and that includes not only the chest strap, but the elastic strap. Remember that when we put these together, it's a lock and groove key. So the top of the heart rate monitor slides in and pops into place. Remember, every time before we put on a heart rate monitor, we're going to wet the conduction pieces so that we can be sure that we get good contact with the skin to get a good signal. So we're going to make sure that our heart rate monitor is ready. With the heart rate monitor, we need a watch to be able to pick up the data that's there. So we need to make sure that it's placed. Because we're doing a VO2 Max test, we need to set up the pneumotac and the headgear that's used on the patient for collecting breath-by-breath data. So we need, first off, we're going to need a piece of headgear. Now with the headgear, it has a foam insert that goes on the forehead to help protect the forehead and to make this a little bit more comfortable. So we need to make sure that A, that this is clean every time, but two, that it's on properly. So it has a little groove here on the top. We're going to place it in and snap it back around. And then we just want to adjust it so that it's nice and even. We want to make sure that our earpieces on the headgear are loose prior to putting them on, because otherwise we take the risk of damaging the headgear. And we're just going to set it off to the side. Other things that we need to make sure is we have our pneumotac, and we need to completely put our pneumotac together. So we're just going to get all of our pieces together, make sure that they're tightened. Remember that when we do set up the pneumotac in the mouthpiece, it's a hand tightened thing. So we don't want it to over tighten it, because we will break it, or we could damage the rubber pieces that are inside of the pneumotac. Once that's together, we can get our mouthpiece. We typically will gauge the size of the person's mouth as to which side, because we have a small and a medium mouthpiece. So with our mouthpiece, we're going to get it ready to place on. We're going to make sure that our gloves are on, because we are going to have to touch our mouthpiece significantly to get it on. So we're going to get it placed. We want to make sure that we also get it on nice and straight, so that it's most comfortable and that there's no leakage of the seal when the person is using it. From here, we also need to make sure that we have the gray stopper. This is going to help make it stay into the mouthpiece. We need a nose clip, and we need tape that we're going to use to help make the nose clip stay on. One of the other things that we're going to need is a stopwatch to be able to maintain time, and our stethoscope. At this point, we should have all of our things that we need for the test set out, along with a blood pressure cuff and a heart rate monitor next to the piece of exercise equipment, either a cycle or a treadmill. We need to have our RPE sign out so we can test, we can rate their perceived exertion. We'll have our hose connected, and our machine is calibrated by this point, so we'd be ready for testing as soon as our patient arrived.
All right, so now that you have completed your PAR-Q and your medical history questionnaire, I'm going to briefly explain the tests that we're going to perform and the consent that you have in front of you. Basically, this form lets you know that the purpose of the test is to measure your cardiovascular and respiratory health and fitness. This is a maximal exercise test, so throughout the test, we want you to perform to your max effort. We have reviewed your medical history and determined that there are no previous conditions, no known conditions that would prevent you from running this test. It also states that you will be performing the test on either a treadmill or a bicycle. We will be monitoring you throughout the test, measuring your heart rate, blood pressure, and possibly the EKG. If you have any signs or symptoms such as a high heart rate, if you start feeling shortness of breath or chest discomfort, please let us know and we can stop the test. You also have the option of stopping the test at your discretion at any point if you feel uncomfortable or feel you need to stop. So what we're going to do during the test is first I'm going to get your resting vitals. After that, we will set you up on the headgear. We'll put a mask on you, and then we'll get you on the treadmill. We'll get your pre-exercise values, and then the test is going to start in a series of stages. So this is a gradual incremental test. We'll slowly increase the speed and the grade of the treadmill throughout the test. We'll also be asking you how you feel during the test, perceived exertion scale. And we want you to go to at least a 17, if not a 20 of max effort. So remember that we will be monitoring you throughout the test. Once you get to a point where you feel that you have reached a maximal effort and you cannot go anymore, we're going to ask you to straddle the treadmill, and at that point we'll get immediate ending values as well. Okay, do you have any questions? Okay, if you don't have any questions and you feel comfortable with the consent, if you'll just sign and date there.
Did you talk about confidentiality in that?
No, it didn't.
You can do it right there, like if you're fine, I just
Okay,
want to remind you
yeah.
that, this information
Right.
is all
Okay.
confidential, nobody but you and someone that you
Right.
give us permission to share it with losing.
Okay, so start.
So,
do you have any questions?
Right. Do you have any questions? Okay. If you don't have any questions, you can sign and date here. I also want to let you know that this information is confidential, and any information we obtain will only be shared with you or someone that you give us privilege for. The test is not to benefit us, but to benefit you.
Okay, Mitchell, today we're getting you ready to do your VO2 Max test to assess your maximal aerobic capacity. What we need to do is get you all prepped with all the equipment that we need to do, and also explain to you so that you fully understand the test that you're going to be doing. So as Ms. Freddie described the test to you during the consenting process, I'm just going to go over it in a little bit more depth here. And feel free to interrupt me at any time and ask questions if you have them. So one of the first things that I'm going to do is I'm going to put the heart rate monitor onto you. When we wear the heart rate monitor, it will be a little bit wet when we first put it on you to make sure that it conducts with the skin. We'll be using that to assess your heart rate throughout the entire test. One of the termination criteria for the test is that you are at 85% of your maximal heart rate at the end of the test, or above 85% of that. So we're using that to assess your heart rate. We would also be, if we were having this as a stress test and we had you connected to the EKG, we would also be using the information off of the EKG to assess that greater than 85% of your heart rate max. We'll also be putting a mouthpiece into your mouth. Now this is the pneumatic and mouthpiece setup. Now the way that it works is that your mouth goes here and your teeth sit onto the two little rubber nubs in the middle, and then your lips go here, and so that this piece is between your lips and your gums. It's a lot like if you've ever been snorkeling or scuba diving. We will take a piece of tape and place it over the bridge of your nose, kind of like a breathe right strip, and that just helps the nose clip to stay on. The nose clip is on so it completely makes it so that you can only breathe through your mouth and not through your nose, so that we can assess actually your breath by breath data during the test to be able to understand what your maximal ventilation is, what your VO2 max is, what your VCO2 max, so we can look at how much oxygen you're breathing in and how much carbon dioxide you're breathing out, and that allows us to get that maximal aerobic or maximal oxygen consumption measurement. okay? So how we get this thing on is we put this piece of headgear on you. So the way that it works is it sits over the top of your head and your forehead goes here. Then the pneumatic will slide in here. So that you will be able to. We will adjust this as needed to make it the most comfortable for you, and I'll give you instructions as we go through. Okay, once we get all that in, we'll just make sure that you are only able to breathe through your mouth and that this is as comfortable as it can possibly be for you. Then once we'll do is we'll move you over to the treadmill and we'll connect the tube from the computer to the mouthpiece, and we'll have you up and we'll have you straddle the treadmill. Once you get up there onto the treadmill, we'll get a pre-exercise blood pressure and heart rate, and we'll go through that rating of perceived exertion scale. Remember that rating of perceived exertion is a whole body effort scale, and it goes from 6 to 12. And we will ask you how you feel. Remember that you won't be able to speak to us, so you'll have to use hand signals to do that. Because this is a maximal test, the effort will never get easier. We're always going to be moving up this scale. So if we look at it as one finger is 6, as if you have just gotten out of bed or you've been sitting on the couch for a while, okay? All the way up to 20, where you don't think you could take more than another step. You have nothing left into you. So when we ask you that, we're gonna ask you, if you start off at that first measurement, and this is 6, then 7, 8, 9, 10. Once we get to those 5 fingers, then it's 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, one of the validity criteria that we need to meet for this test to know that it's a good test is that the RPE scale is above a 17. Okay, so that's one of the things that we're having you push towards to make sure that we know that. In addition to that heart rate criteria and looking at what your energy exchange ratio is for how much fuel, what type of fuel you're using. Okay, so those are some of the things that we're looking at to make sure this is a good test. Now, after we've gotten those resting measurements on the treadmill, what we'll do is we'll get you ready. We'll do a countdown to get you ready to step onto the treadmill. The treadmill will start. During the actual test, it's 3-minute stages because we're using a Bruce protocol test. So every 3 minutes, the speed and the grade will increase, okay? And your goal is to go as long and far and hard as you can during the test. During the test, we remind you that we need you to not use the handrails, okay? If you need them to balance yourself for a second or two, that's fine, but not to hold on to them because that will alter your VO2. Another thing is when you have the headgear on, we need you to keep your mouth completely sealed around the mouthpiece. Because if you start moving around in your mouth or trying to sip little pieces of air out the sides of it, it will actually alter your VO2 and actually cause it to go down. And we don't want that because we want to know what your maximal capacity is. Okay, during the test, every 3 minutes we'll be getting your heart rate and your blood pressure, and we're going to be asking you where you feel on that rate of perceived exertion chart. Okay, so you'll give me a hand signal. When you think that you have nothing left of you in the tank for this test, you are going to grab the handrails and straddle the test, and we will then terminate the test. At that point, we're going to get an immediately post-exercise measurement of heart rate, blood pressure, and RPE. Then as soon as those are done, we'll allow you to get start a cool down, walking on the treadmill. We'll get that headgear off of you. And we'll start your cool down. Once we've given you about 6 minutes on the treadmill for an active cool down, we'll move you back over to the chair and we'll continue to monitor you until your vitals have returned back to pre-exercise levels. What we will use this data for is to assess your maximal aerobic capacity, and we can then use it to prescribe you a training plan, to give to your coach, or for you to use as a way to adjust your fitness level and to adjust your training capacity so that you can have optimal performance. Do you have any questions so far? Okay, so at this point, we're going to start getting you ready for all this. All right, so we're going to get this heart rate monitor on you. As I said, I'm going to have to wet it a little bit. this is going to be a little cold, just to warn you. Remember that when you put a heart rate monitor on, it needs to be completely flush with the skin, and it goes over the top to attach and snap in. Remember that when we get this on, we wanted to get it nice and level so it doesn't slip. And when we look at it from the side to know that it's tight enough, we should just barely be able to slip 2 fingers underneath the strap. If we can get more than 2 fingers, it's not tight enough. Especially as he gets sweaty, what's going to happen is it's not going to be a heart rate monitor anymore, it's going to be a belt. Okay, so we want it nice and tight here. From there, we just need to make sure that we've got this on and well, and we've gotten enough moisture in here to be able to get contact. So we're just going to start a heart rate monitor just to assure us that we do have a working heart rate monitor going. We have a heart rate working, so we have a standing heart rate now at 57 beats per minute. Good. All right. So can you stop it for just a sec?
Sure.
Or just let it run for a minute?
Yeah.
Lift the tape over there.
I don't think there's any left.
I think I can get enough.
It's freezing in here.
It's always freezing in here.
Feels good.
Yeah, because you're exercising.
Yeah.
Okay, you ready? Okay, the next thing is I'm going to ask you to take this piece of tape and place it over the bridge of your nose like a breather aid strip. Okay? Just to cover the entire bridge. Perfect. Next thing, we're going to put on his headgear. We want to make sure that the 2 side pieces are loose so that they move easily when we do this. Now, the back and the top are both adjustable here to make sure that it fits snugly onto his head. So when we put this on, we want it to sit snug here with the forehead strap right across the front of his forehead and this top piece flat within his head. Remember that based on how much hair someone has, or if they have a large ponytail or bun, you may have to do some adjustments to get this flat. From here, I'm just going to hold on to the top here. It just basically helps this stay secure, and I'm going to tighten this down. Is that too tight? How does that feel?
Just probably one off, one to back it up is fine. Oh, that's a little too loose.
Right there?
Feels good right
Don't
there.
want it to be able, can you shake your head? Does it move? Okay.
You could probably tighten it one more. Okay.
There we go. The other thing to make sure is that it's flat and even across the top of his head. Because otherwise, as he runs, the mouthpiece is going to slip and move within his mouth. Okay, so from here, we're going to put the mouthpiece in. Now, once I put this into your mouth, you're not going to be able to talk to me. So do you have any questions before we continue? Okay. All right, so what we're going to do is we're going to adjust these around. You're not going to put it into your mouth just yet.
Okay.
All right, now I'm going to have, actually, let's just, hold on. Let's take this back a minute. We'll do this instead.
Now, if it does happen to loosen up around my head, can I reach back there and crank it?
Yeah,
once? Okay.
absolutely. Yeah. Okay, I'm gonna actually let you do this. So I want you to take this and I want you to place it into your mouth and get yourself situated with your teeth in here and mouth out here. Then I'm gonna have you lift
I'll
it.
let you go over that.
Yes. So then I'm gonna have you lift this up and back and then continue to hold it as I adjust this part. Good. Now hold it for me up and back. There you go. We place the gray stopper onto the white side to ensure that this leg does not slip off during the test. Okay, hold that for me. I'm going to adjust these. Remember when you adjust the side pieces that they turn opposite of each other? Okay, go ahead and release it. See if it falls. How does that feel? Move your head around. Now that we have Mitchell's headgear on, we're getting him prepped to actually start running the test. We have set the Parvo cart up with his information into the computer. So our next step is to connect the tube from the computer to the pneumatag. On and secured. And then we want to adjust this cord so that it's not pulling on his mouth. We need to watch it during the test to make sure that, especially as he starts to run faster and the incline starts to increase, that this isn't pulling a lot on his mouth. We want to try to keep it as comfortable as we can for him during the test. We want to do a double check to make sure that everything is connected. Is the nose clip on? Is the headpiece comfortable? Is the tube connected? Do we have all the correct values entered into the computer at this point? So Mitchell, I'm going to have you take about a step forward, and Ms. Freddie is going to start to get your pre-exercise heart rate and blood pressure. Remember that when we run a test, one of the things that's really important is we not only keep an electronic record of the data on the computer, but we're also going to be recording this in a paper file so that we have a backup, and also it gives us a place to write notes should there be anything that occurs during the test, so we have a better record of his overall performance during the test.
Okay, go ahead and straddle the treadmill for me. One more step up. Good. Pre-exercise heart rate is 59. Press your hand right there. (116/78).
And Mitchell, on that RPE scale, can you quickly be via hand signal where you feel you're at right now? RPE of 6. Okay, you'll straddle the treadmill. We are going to have you stay straddled. Once the treadmill belt starts moving, you can actually use the handrails to step on. After that, please do not use the handrails. When you have nothing left again, you're going to grab these handrails, straddle the treadmill, and we will stop the test and begin your cool down. Are you ready? Okay, so we're going to get ready to start the treadmill in just a few moments.
We'll tell you when you're ready to go.
Okay, go ahead and step on. Now, some of the really important things that during the test, as the technician, we need to be paying attention to is we need to be watching our computer screen to understand what the values that we're getting. So we need to be tracking his VO2, his VCO2, his respiratory exchange ratio, and his heart rate during the test. In addition, we need to be watching our patients. So go ahead and get a 1 minute heart rate.
94 beats per minute.
We need to be watching his movements. We need to make sure that his gait is solid, that he's not getting too far back on the edge of the treadmill because we don't want him to fall and injure himself. We need to kind of be looking at where he's at with the mouthpiece on his mouth. He needs to keep that sealed and those lips tight and close around there. And then, we just need to kind of just be aware of our overall surroundings as we're doing this. And talking with our technician if we have other help so that we're all working together. Doing good, Mitchell. 2-minute heart rate.
93 beats per minute.
Go ahead and start blood pressure whenever you're ready. Now remember, during the test, every minute of the test we are assessing heart rate, and then just before the 3-minute mark of each stage, we're going to be getting heart rate, blood pressure, and RPE, so that we have those values prior to the next stage change, so that we know what his levels were at that current stage before moving on to the next stage. At some point during the test, there will become a point where we'll no longer be able to hear the blood pressure, and that's fine and normal. Where are you at on that RPE scale? You can use this hand. A 9?
124/78.
Heart rate is 87. We move on to the second stage of the test. Heart rate?
97.
Heart rate?
102. (130/84).
Did you put your RPE on that scale? 11? 12.
Heart rate's 107.
We're getting ready to move on to that third stage. Doing great, Mitchell.
122.
Doing great. Keep it up. Eight-minute heart rate.
125.
One thing it's really important to remember, especially as the incline starts to go up, is that we have to support the arm during testing, but we also need to make sure that we're not impeding their movements while we're doing that. The other thing is that try to stay out of their way as much as you can, but also help to support them, because once you take that arm out of the way, it's going to change their balance some.
130 over 80.
Read out on that scale.
12.
So 12,
13.
13. Excellent. Heart rate.
126.
Moving on to stage 4. Doing great, Mitchell. Remember that when we do any type of incremental test, there's typically a stage in there that's a little awkward. Your patient might find it hard. They're not sure if they're supposed to walk yet. They're not sure if they're supposed to run. That is very normal. And so this is a stage that it's really important that you kind of cheer them on and keep them going, because it does feel a little weird to be moving in this way. You're doing great, Mitchell. Heart rate.
150.
Doing great. Keep it up. Minute heart rate.
154. over 84.
Where you at on that RPE scale?
13. 15. 158.
Doing great, Mitchell. Heading into stage 5. Use those arms to drive yourself up that hill. This is where it really starts to speed up. You look great. Keep it up. Once we get into these higher inclines and faster speeds, this is a really good time to double check your patient's positioning on a treadmill. Make sure that they're not getting too far towards the back, because we don't want to take a risk of anybody slipping or falling. Doing great. Keep it up. You got it, Mitchell. Drive up that hill. You got it. Great work. Keep it going. You're doing excellent. That mouth sealed. 14 minutes.
174.
Great work. Where are you at on that RPE scale? 15? Oh, 18. Heart rate?
179.
Doing great, Mitchell.
Got it, Mitchell.
You got it. Drive those arms. You can make it. You can make it.
Come on. You got it.
Going into the 6th stage.
Come on, Mitchell. Keep
Great
going.
job.
Keep
Everything
going.
you got, Mitchell.
Use those arms.
You got it. Drive up that hill. Push with the arms.
You got it. Come on. Keep going.
You got it. Everything you got. Everything you got.
Come on.
Push, push, push up that hill.
Come on.
Keep working.
You got it. Come on. Use
You got it.
those
You
arms.
got it. Great
Come on.
job. Great job. Up that hill. Drive it.
Come on.
Come on. Everything you got. Everything you got. Come on.
Keep
Push,
going.
push.
Keep pushing. Keep
Push
pushing.
hard. Push hard. Push hard. Keep your mouth sealed. Good job. Everything you got.
Good job. Good job. Doing great. You got it.
16
Come on.
minutes.
Come on. 186.
Great job. You got it. Everything you got.
Come on. Grab
Come on,
the
everything you
treadmill
got.
and need to stop. Come on. All right.
Come on. Push it hard. Push it harder. Come on. You got it.
Come on.
Everything you got. Mitchell, keep that. Keep your mouth sealed for me, okay? So we get those final measurements. Got it.
Good
Excellent.
job. 189 heart rate.
Excellent.
Don't squeeze.
Where are you at the very end of that test? All right. That's what we like to see.
Just relax your arms. You can take that nose piece off. With your other hand. 140 over 88. Did good.
Step on that treadmill, start your cool down.
Excellent job.
Good job, Nick. Great.
Yeah, that was awesome, dude.
I'm expecting that. It's so much easier when
You
you're
didn't
just
believe.
running.
1 minute heart rate.
154.
We're gonna let you walk here for about 6 minutes, and then we're gonna move you over and finish your recovery portion, okay? We'll get you something to drink, we'll get you a towel, all those things. You did excellent.
We've now moved into seated recovery, so we are going to continue to monitor the patient with heart rate every minute and blood pressure, and then we're going to monitor them continuously for up to 30 minutes. As soon as heart rate gets back down to baseline and blood pressure and he doesn't feel any signs or symptoms. At that point, we're going to ask him to get up and walk around a little bit so we can assess his gait, again making sure that he's doing good after the test. We also want to make sure to provide plenty of fluids and make sure that if he has any other signs or symptoms like shortness of breath, dizziness throughout the rest of the day, to let us know and to contact his doctor. Okay, so now that we're finished with the test, we're going to take your results and we're going to use them to develop an exercise prescription for you based on your aerobic fitness. And once we do that, we'll get back with you in about 1 to 2 weeks with feedback and your results, and we can go over at that point. Do you have any questions for me?
No.
Okay. We thank you for coming in, and we'll be contacting you shortly. After you've reviewed the exercise test results and created an exercise prescription for your client, bring the client back in to go over their results and exercise prescription. Here are the results from the Max Aerobic exercise test using the Bruce protocol. We can review patient information, test protocol, test environment, and the base values for sampling at the top. We can also see along the x-axis VO2 in liters per minute, VO2 in milliliters per kg per minute, METs, VCO2 in liters per minute, VE, which is minute ventilation in liters per minute, RER, which is respiratory exchange ratio, RR, which is respiratory rate in beats per minute, in breaths per minute, vital capacity in liters, FeO2 and FeCO2, which are constants throughout the test, heart rate in beats per minute, the treadmill speed and grade throughout the test, and the calories expended. If we look at the bottom of the chart at minute 16:31, we will use those for his max values. Notice his absolute max VO2 in liters per minute is 4.16 liters per minute. His relative VO2 is 56 milliliters per kg per minute, and his absolute MET capacity is 16 METs. Table 4.9 in the guidelines for exercise testing and prescription provides normative values for VO2 max estimated from treadmill speed and grade with specific reference to age and sex. Finding your client's values in table 4.9, we can see that a relative VO2 of 56 milliliters per kg per minute classifies him as above the 95th percentile range for his age and gender. This also classifies him as superior for cardiorespiratory fitness.